Suffolk's Mental Health Trust once was rated the worst in the country, but now it's improved, according to inspectors. Community services for adults run by the Norfolk and Suffolk Foundation Trust have been rated as good, but the Care Quality Commission says there's still concerns around the crisis services, particularly the 111 phone line. Earlier we heard from Caroline Donovan, the boss at the Norfolk Suffolk Foundation Trust.
I really believe that the NSFT is in the best place it's been in for years. We are really, really optimistic. There's many indicators that are demonstrating our improvement, but we absolutely recognise that we have more to do. We're really starting to see lots of people coming to work and stay working with us. It's really important that local people feel it's a good place to work and that they want to stay with us. And most importantly, that service users and carers feel that we're supporting them with compassion.
Natalie McClellan is a campaigner for community mental health services. She lost her 24-year-old daughter, Rebecca, back in November 2023. The paramedic was diagnosed with bipolar disorder in 2020 and died in her flat in Ipswich. Natalie, thanks for coming on this morning.
Good morning.
When you hear that the community health service has been given an overall rating of good, which is up from requires improvement, your reaction to that is that what you feel the rating it deserves?
I welcome any sustained improvement from the Trust, and as a campaign we want nothing more than for people to be receiving good, robust mental health services. Unfortunately, that's not what we see on the ground, and it really saddens me, but doesn't surprise me, that crisis services are still unsafe.
Yeah, crisis services, of course, very close to you because of your daughter. The crisis service still requires improvement, and particularly, Natalie, around the Woodlands unit in Ipswich. The Trust says work's taking place to address this. What are your thoughts on that? Because wasn't your daughter turned away by staff there?
She was, yeah. 2 years ago, she turned up in crisis to the Woodlands Centre, and I have, video footage of her begging for help, and she was turned away. So yeah, it's a subject dear to my heart, and we're 2 years down the line from that, and still it requires improvement, which is concerning. I do understand they're trying to make sustained improvement, and I do believe that that's what they want to do, but actually, again, I say I don't know how effective some of those things that they're implementing are.
And your daughter had a year's worth of care from Norfolk and Suffolk Foundation Trust. How was it?
Sporadic, poor. She suffered things that people are still suffering now. We're still seeing the same things. Lack of risk assessment, lack of professional curiosity, lack of ADHD referral. These things were cited in her investigation. Earlier in the year, the Trust issued their review into PSERF, which is their patient safety framework. Those themes are still running through that review, and actually, the prevention of future death reports that have come out from the coroner, we're still seeing the same themes coming through time and time again, and this has been going on for years. So I understand Caroline's only been in post since November 23 actually, but again, we're 2 years down the line, still seeing the same thing. So you start to wonder how effective some of these changes are, and I think there's still a cultural problem within the Trust that under their well-read, it's already been said that, they hear a lot about the staff and the governance, but actually very little focus from their senior leaders about service users and their families, their carers that are under a tremendous strain, and some of the most vulnerable people in society, and they're just still not getting the support that they need.
So for you, the priorities for them need to be the families, it needs to be the culture.
Absolutely. They have to forge a culture of safety for their staff to be able to speak up. It was only a few months ago they were found to have a problem with racism within the Trust. They need to look after the carers that are looking after people in mental distress. There seems so very little support for those. And actually, when they're in crisis, they need help now. And actually, we try and prevent them to getting into crisis. I think that's the key here. And still, that's not happening.
Natalie, thank you for talking. How are you bearing up, by the way? It's only been 18 months since you lost your daughter.
Ask me another. Not an easy journey,
No,
but I am determined that the other families will not suffer what we have, and that the other, service users shouldn't suffer what she suffered. They just need good mental health care.
Natalie McClellan there, who lost her daughter, 24 years old. Her thoughts on the report that's come out, the Suffolk Mental Health Trust improving, according to inspectors.